Hey fellow lab rats, this is Rebecca from the Lab Rat YouTube channel. In this lecture, we're going to be discussing phlebotomy and healthcare. Let's get started. After listening to this presentation, you'll be able to do the following. You'll be able to state the traditional and expanding duties of the phlebotomist, be able to describe the professional characteristics that are vital for a phlebotomist to possess, discuss the importance of communication and interpersonal skills for the phlebotomist within the laboratory, with patients, and with other personnel and other departments in the hospital. You'll also be able to describe the three components of effective communication, list the barriers to verbal communication and methods to overcome these barriers, describe correct listening and body language skills that are expected of a phlebotomist, and be able to state the 6 rules of proper telephone etiquette. After this presentation, you will also be able to define cultural diversity and discuss the actions needed by a phlebotomist when encountering a patient from a different culture. Also, you'll be able to state the competencies expected of a certified phlebotomist. You'll be able to discuss the role of CLIA, CLSI, TJC, CAP, and COLA. And lastly, you'll be able to describe the functions of the nursing, support, fiscal, and professional hospital service areas and the function of each of these service areas. You'll also be able to describe the different healthcare settings where phlebotomists may be employed in. In addition to the learning outcomes of this presentation, there are multiple key terms that we will be discussing. These are accreditation, alternative medicine, AABB, ASCLS, ASCP, CMS certification, CLSI, CLIA, CAP, and COLA. More key terms from this presentation are confidentiality, CE, which is also continuing education, cross-training, cultural diversity, decentralization, DRGs, FDA, HIPAA, in vitro, in vivo, NACLs, and the National Patient Safety Goals. Additionally, more key terms here: National Phlebotomy Association, or NPA, patient-centered care, phlebotomists and phlebotomy, professionalism, PHI, requisition, samples, specimens, standard of care, and zone of comfort. Now that we have identified the learning outcomes and the key terms for this presentation, let's start discussing them. We'll start with the history of phlebotomy. The term comes from phleb, meaning vein, and otomy, meaning incision. Therefore, phlebotomy is defined as an incision into a vein. It's actually one of the oldest medical procedures. Bloodletting is a term used to describe the removal of blood from a patient to prevent or cure illness. Originally, people used bloodletting as a medical procedure. It's thought that George Washington actually died from excessive bloodletting. Today, there are several diseases that benefit from having blood drawn, such as hemochromatosis and polycythemia vera. A person with hemochromatosis, which is an inherited disorder, benefits from periodic blood collections to prevent excess iron from being deposited into the tissues. Polycythemia vera is a blood disease that starts with overproduction of red blood cells and eventually becomes aplastic anemia. So it's overproduction of red blood cells followed by no production of red cells, which is aplastic anemia. So therapeutic phlebotomy, which is the controlled removal of a large volume of blood, is used for treatment for these two disorders. Back in the day, there were different devices used for bloodletting, so including the use of leeches, which are a type of blood-sucking worm. Today, we just use blood collection supplies, usually at the blood donation center. The role of the phlebotomist now is primarily the collection of blood for laboratory testing. The phlebotomy team is a specialized area of the clinical laboratory. They are key players in the laboratory, and good skills make them vital. There is a possibility of cross-training and being able to expand upon training depending on the employer. The phlebotomist is the primary liaison between the patient and the laboratory. The traditional duties and responsibility of a phlebotomist are to correctly identify the patient prior to specimen collection, which of course is the most critical step, collection of the appropriate amount of blood by venipuncture or dermal puncture for the specific tests that are ordered, selection of the appropriate specimen container for the specified tests, and correct labeling of all specimens with the required information. Additional traditional duties and responsibilities include the appropriate transportation of specimens back to the laboratory in a timely manner and, of course, at the right temperature. The phlebotomist must also have effective interaction with patients and other hospital personnel. Other important duties of the phlebotomist include the processing of specimens for delivery to the appropriate laboratory departments, performance of computer operations and record keeping pertaining to phlebotomy, maintaining patient confidentiality according to HIPAA laws. The phlebotomist must also observe all safety regulations, quality control checks, and preventative maintenance procedures, as well as attend continuing education or CE programs as required by their employer. Phlebotomists may be required to train other healthcare personnel to perform phlebotomy procedures depending on where they are employed. They may also be responsible for monitoring the quality of samples that are collected on the hospital units. So for example, if the samples are in the correct tubes needed for each test, are the tubes filled properly, etc. They may be required to evaluate procedures associated with proper specimen collection and performing point-of-care testing. Now, point-of-care testing are those that are performed outside of the laboratory, frequently at the patient's bedside. A really good example of a point-of-care test is a glucose level taken via a handheld glucose meter. Some phlebotomists may even be required to perform electrocardiograms on patients. And this is a simple procedure that requires electrodes to be placed on the patient's chest to record the heart's electrical signals. And this procedure can help to check for various heart conditions. Now, healthcare is dynamic, meaning it is constantly changing. Recent changes in the healthcare delivery system focus on both efficiency and cost effectiveness. Healthcare systems are faced with a high demand but have a limited budget in which to provide necessary services. Healthcare systems are continually looking to improve the cost effectiveness without compromising their quality of care for patients. Recent changes put the patient at the forefront of their own care. This means that the patient's needs, values, and preferences are respected and allows them to be in the driver's seat of their own healthcare plan. Cross-training of personnel means as a phlebotomist, they may be also trained in specimen processing in addition to venipuncture procedures. There's also been a push for decentralized phlebotomy. Now, centralized phlebotomy is where the laboratory controls the management and delivery of phlebotomy services, whereas decentralized phlebotomy allows nurses and patient care technicians to collect inpatient blood specimens. Phlebotomists are a part of the service-oriented industry and are the faces of the laboratory. The phlebotomist regularly interacts with patients and are usually the only laboratory staff member that has any contact with the patients. Because of this, it is critical that a phlebotomist is kind and pleasant with every patient they draw a sample from. So what personal and professional characteristics make a good phlebotomist? A phlebotomist must be dependable and responsible. They must also show up for work on time every day and produce consistent and correct work while following proper procedures. They must be cooperative, meaning they are willing to work with others nicely. They must be committed, meaning they take ownership of their work and serve as good ambassadors for their place of employment. Phlebotomists must also be compassionate not only to patients, but also towards coworkers. Remember that patients who encounter phlebotomists may be sick, may be scared, or may be nervous. It's expected of us as phlebotomists to be compassionate towards them. In addition, compassion for coworkers, meaning actively listening to coworkers without judgment, accepting criticism, and being careful when expressing opinions so feelings are not hurt. It's also imperative that phlebotomists have integrity and are honest. This means they are expected to respect the privacy of coworkers and patients, take responsibility for their actions, and have sound judgment. Phlebotomists must obviously be competent at drawing blood from patients. They must be organized, so this allows for work to be done accurately and helps to eliminate costly mistakes. A phlebotomist must also be flexible. Again, healthcare is dynamic. There may be changes to the work schedule and changes to policies and procedures. Phlebotomists must be able to adapt to new situations easily and be willing to embrace change. Keeping patient information confidential is essential in any healthcare career field, especially in phlebotomy. The Health Information Portability and Accountability Act, or HIPAA, not to be confused with HIPPO, was passed in 1996. HIPAA is a federal law in the United States that discusses the use and disclosure of patients' health information, also called PHI, or Protected Health Information. As a healthcare worker, a phlebotomist should never discuss a patient's information with anyone who does not need to know about the said patient. So a physician, nurse, or other healthcare worker that is directly involved in the patient's care, these are all the people that are allowed to know the patient's health information. Nobody else is allowed. So violations of HIPAA are incredibly serious and will result in job termination. So do not discuss patient health results or other information with anybody that doesn't need to know, period. I've already stated that phlebotomists are the faces of the laboratory. It's important for these workers to keep a professional appearance. This slide discusses the general appearance guidelines for those that work in the phlebotomy profession. Phlebotomists need to follow their employer's dress code, but this is a good general guideline. Clothes should be clean and unwrinkled with clean and appropriate closed-toed footwear. Only conservative jewelry and makeup should be worn. Perfume and perfumed lotions are generally not allowed. Hair and facial hair needs to be clean, neat, and trimmed. If the phlebotomist has long hair, it will need to be pulled back. Poor personal hygiene is unacceptable, so daily baths, teeth brushing, and deodorant must be worn. Fingernails must be clean and short, and artificial nails are unacceptable as they promote the growth of fungus. Phlebotomists need good verbal, listening, and nonverbal skills. Verbal skills allow phlebotomists to introduce themselves to the patient and to explain the specimen collection procedure to the patient. Listening skills required by a phlebotomist are to look directly at the patient and encourage the patient to openly discuss their concerns or questions. Nonverbal skills are being able to read body language. This includes things like facial expressions and eye contact. A phlebotomist should look directly at the patient when communicating with them and maintain positive body language like smiling. There are a variety of barriers to effective verbal communication between people. Hearing impairment, emotional level of the patient, education level of the patient's age, language barriers, the medications the patient may be prescribed, and the health status of the patient are all examples. We will discuss these barriers and effective ways to overcome them on the following slide. So on that previous slide, I listed the types of verbal communication barriers. This slide suggests methods to overcome these specific barriers. The first barrier listed is age and education levels. To overcome these potential barriers, the phlebotomist must use age-appropriate phrases. This means that the phrases that would be used for a 5-year-old child patient would be different from those of a 60-year-old patient. Also, avoiding medical jargon. So sometimes being in the healthcare field, we forget that patients may not know the specific medical names for things. So an example of this is a patient may not know what the word phlebotomy means. So it's best to tell them that we are there to collect a blood specimen rather than we are there to perform a phlebotomy procedure. Some patients may be hard of hearing. To overcome this, it is important for the phlebotomist to speak loudly and clearly and look directly at the patient. If this does not work, communicating with the patient may need to be done in writing. Phlebotomists will encounter patients that are non-English speaking. For these patients, a hospital-based interpreter can be used to communicate, as well as with hand signals. Now, some patients may have visual impairments. To help these types of patients, it's important that phlebotomists speak directly to the patient and explain the procedure fully. Instructions can be provided in large print or in Braille, which is a tactile writing system. Phlebotomists also should have good active listening skills. People with good active listening skills look directly at the person who they are talking to. They allow the other person time to express their feelings and concerns. And active listeners also provide appropriate responses to feedback given to them by the other person, as well as encourage communication from the other person by asking them questions. These are all things that are important for a phlebotomist to do. A lot of communication between people is nonverbal through positive and negative body language. Examples of positive body language are smiling, maintaining eye contact, displaying confidence, and maintaining the proper zone of comfort. Examples of negative body language are shuffling, not using eye contact, and acting distracted. It's important that phlebotomists strive to use positive body language around patients to display professionalism and to ensure that the patient is comfortable around them. On the last slide, I mentioned something called the zone of comfort. This means the amount of distance between the patient and the phlebotomist that makes the patient feel comfortable. Based on culture, zones of comfort distance vary. So for American culture, the amount of distance for an intimate zone of comfort is 2 feet. For a personal zone of comfort, 2 to 4 feet. For social zones of comfort, 4 to 12 feet. And for public zones of comfort, greater than 12 feet. The 2020 COVID-19 pandemic likely changed this zone of comfort distance. A phlebotomist must remember that they will be within the intimate to personal amount of space when collecting a patient's blood, so it's vital that they do not make the patient feel uncomfortable. The cultural diversity of many facilities may be different. However, phlebotomists must realize that patients may have customs, beliefs, religions, and values that are different from the way that they were raised. Some cultural guidelines to follow is to always smile and use a friendly tone of voice. Phlebotomists must be alert to patient reactions. They should not stereotype. They should be mindful of personal space. They must also take the time to explain procedures when a patient seems apprehensive and always show respect to the patient. Phlebotomists do have to take phone calls on the job. These calls may be from physicians, nurses aides, laboratory workers, or other healthcare professionals. Proper telephone skills are needed for any healthcare worker. It's important to speak clearly and be prompt and polite while on the phone. When answering the phone, the phlebotomist should identify themselves, where they are working, and ask how they can help the caller. So, for example, I would answer the phone, "Laboratory, this is Rebecca, how may I help you?" An incorrect way of answering the phone would be "Lab," or "This is Rebecca," or just "Hello." Accurate information must always be provided, and if the phlebotomist does not know the accurate information, the caller needs to be referred to someone who can help them. So for example, if I got a call about something I was unsure of, I would tell the caller, "I'm unsure of the answer to that question. However, let me get you in touch with someone who can answer it for you." An incorrect response would be, "I don't know, sorry." If the phlebotomist is unable to help the caller and needs to transfer them to another person, they should provide the caller with the number or extension of the person they are transferring them to, in case the call fails. If the phlebotomist is busy and needs to put the caller on hold, they must first check to see if the caller has an emergency. Someone could be calling about a critical situation. Standards for education and certification are developed by various agencies. The National Accrediting Agency for Clinical Laboratory Science, or NACLS, is the premier agency for international accreditation of educational programs in the clinical laboratory sciences and related healthcare disciplines. The American Society for Clinical Pathology, or the ASCP, is a professional association that provides programs in education, certification, and advocacy on behalf of patients, pathologists, and laboratory professionals. The ASCP certifies many types of laboratory professionals, including medical laboratory scientists, technologists, and phlebotomists. The National Phlebotomy Association, or NPA, was founded to establish professional standards and code of ethics for phlebotomists. There are various agencies that certify phlebotomists as well as different routes to becoming a phlebotomist. There are structured programs that combine classroom lectures or phlebotomy and clinical practice. These can be held at hospitals, community colleges, or technical institutions. It's important that these programs use national training guidelines, which I will discuss here in a bit. So I've just mentioned that there are a lot of different agencies that certify phlebotomists. There is an American Certification Agency, or ACA, and the designation for this certification is Certified Phlebotomy Technician, or CPT ACA. There is an American Medical Certification Association, or AMCA, and the designation for this certification is Phlebotomy Technician Certification, or PTC AMCA. There is AMT, or American Medical Technologist Certification, and the designation for this certification is Registered Phlebotomy Technician, or RPT, AMT. There is the American Society for Clinical Pathology, or ASCP, and the certification designation for this agency is Phlebotomy Technician, or PBT, ASCP. There's also an American Society of Phlebotomy Technicians, or ASPT, and the designation for this certification is Certified Phlebotomy Technician, or CPT, ASPT. There's the National Center for Competency Testing, or NCCT, and the designation for this certification is National Certified Phlebotomy Technician, or NCPT, NCCT. There is the National Phlebotomy Association, or NPA, and the designated certification is Certified Phlebotomy Technician, or CPT NPA. And also, there is a National Health Career Association, or NHA, and the certification designation for that is Certified Phlebotomy Technician, or CPT NHA. So all of these agencies that I just listed are agencies that a phlebotomist can get certified through. Structured programs that offer classroom lectures on phlebotomy and also clinical practice must use national training guidelines. The National Accrediting Agency for Clinical Laboratory Science, or NACLS, has a guideline for entry-level phlebotomist competencies. So all programs should ensure that their trained phlebotomists can do or have the following. They must be trained in knowledge and healthcare delivery, infection control and safety, and medical terminology. They must also have the knowledge of basic anatomy and physiology, understand the importance of specimen collection and integrity, and also they must have knowledge of venipuncture collection equipment, any special precautions, tube additives, and any type of interfering substances that can occur in laboratory testing. The NACLS guidelines for entry-level phlebotomist competencies also include performing standard procedures for venipuncture collection, understanding of test requisitions, the proper transport of specimens, and the proper processing of specimens. Entry-level phlebotomists must also understand quality assurance and quality control in phlebotomy, as well as use effective and appropriate communication skills with patients, laboratory staff, and other members of the healthcare team. After the completion of a phlebotomy certificate program, a phlebotomist is not yet certified. This completion makes them eligible to sit for a certification exam to get certified. Once the certification exam is successfully completed, then the phlebotomist is what we call officially certified. Each agency has different requirements, but a lot of the certification examinations are what we call adaptive. These are exams that are taken on a computer and are designed to adjust their level of difficulty based on the responses provided to match the knowledge and ability of the test taker. So if a student gives a wrong answer on an adaptive test, the computer follows up with an easier question. If they give a correct answer, the next question will be more difficult. After passing a certification exam, phlebotomists must complete annual continuing education requirements to maintain their certification. Continuing education is required to keep certified phlebotomists in step with advances in the field and newer updated protocols. Continuing education courses can be online or in person and may be offered by the phlebotomist's place of employment. After the completion of a phlebotomy program or the completion of a certification exam, phlebotomists can join a phlebotomy organization that advocates for members of the profession. A licensure is something that may be required by some states. To become licensed, there are usually educational or training requirements and then the completion of a certification exam. Once licensed, the phlebotomist must complete continuing education and receive continuing education units that they will report to their certification agency to maintain their licensures. These CEs must be reported within a designated time range, and if they're late, the phlebotomist may have to take the certification exam again to get recertified. The Clinical Laboratory Improvement Amendments, or CLIA, is a federal regulation which includes standards applicable to all U.S. facilities or sites that test human specimens for health assessment or to diagnose, prevent, or treat disease. CLIA requires laboratory workers to have certain amounts of education, and it also requires that deemed agencies inspect laboratories to ensure compliance with the law. These organizations are the Joint Commission, College of American Pathologists, and the Commission on Laboratory Assessment. The Clinical and Laboratory Standards Institute, or CLSI, sets recommendations for laboratories that maintain compliance with laws and standards of care. The National Accrediting Agency for Laboratory Sciences, or NACLS, certifies training programs. CLIA also provides standards for patient test management, quality assurance, quality control, proficiency testing, personnel qualifications, complaint investigations, and inspections. This is a list of CLIA's classifications of laboratory testing. Again, these are based on each test complexity. So the first classification is waived testing, and these are tests that CLIA has determined are easy to perform with little risk of error. Waived tests do not require any special education and can be performed with written instructions at home. An example of a waived test would be an at-home pregnancy test. Provider-performed microscopy procedures are microscopic tests that can be performed by a physician or a mid-level practitioner. An example of a provider-performed microscopy procedure would be a microscopic urinalysis. So this is where the physician or a mid-level practitioner looks at urine samples under the microscope to help aid in diagnosis. So for things like a urinary tract infection would be something that would be diagnosable based on a urinalysis that is looked at under the microscope. The next level of classification are the moderate complexity tests. These are tests that CLIA has determined require anyone who performs them to have documentation of training in the test principles and instrument calibration. Moderate complexity tests require proficiency testing and require laboratories who perform them to be inspected. An example of this type of test is a complete blood count, also called a CBC. This is a test run in an analyzer that gives counts for red blood cells, white blood cells, hemoglobin, hematocrit, etc. on a patient's whole blood sample. High complexity tests are those that CLIA has determined require sophisticated instrumentation and require a high degree of interpretation. These tests also require proficiency testing, and any laboratory who performs these tests must be periodically inspected. An example of a high complexity test is urine culture and sensitivity. So if a patient has a bacterial urinary tract infection, the patient's urine is plated on microbiology plates, and the bacteria is allowed to grow. Once it is grown, the bacteria species is then identified, and the antibiotic type that kills that specific species is identified to ensure that the patient is on the right medication. So this would be a high complexity test. The Clinical and Laboratory Standards Institute, or CLSI, is a nonprofit organization that promotes the development and use of voluntary laboratory consensus standards and guidelines within the healthcare community. They also provide training and outreach educational services throughout the world to help laboratories achieve sustainable quality and implement quality management systems to better diagnose and treat patients. Now, the Joint Commission seeks to continuously improve healthcare for the public in collaboration with other stakeholders by evaluating healthcare organizations and inspiring them to excel in providing safe and effective care of the highest quality and value. The Joint Commission sets national safety goals to improve the accuracy of patient identification, the effectiveness of communication among caregivers, and to reduce the risk of healthcare-associated infections. The Joint Commission inspects organizations every 3 years and laboratories every 2 years. The College of American Pathologists, or CAP, is a leading organization of board-certified pathologists, serves patients, pathologists, and the public by fostering and advocating excellence in the practice of pathology and laboratory medicine worldwide. CAP provides laboratory accreditation, provides proficiency testing to those laboratories, and inspects those laboratories every 2 years. The Commission on Laboratory Accreditation, or COLA, or C-O-L-A, is a physician-directed organization whose purpose is to promote health and safety through accreditation and educational programs. COLA accreditation is more popular among physician office laboratories or independent laboratories, whereas CAP accreditation is more popular with hospital-based laboratories. So now that we've talked about what makes a good phlebotomist, how to get educated and certified as a phlebotomist, let's talk about where phlebotomists work. So they can work at hospital laboratories. This can either be in an outpatient draw site at the hospital where people can come in, get their samples collected and leave, or they can work in an inpatient hospital setting, where phlebotomists travel to areas of the hospital to collect samples from patients that are admitted there. Phlebotomists can also work in physician office laboratories, drawing patients that come in for their doctor visits. Also in health maintenance organizations, or HMOs. So HMOs are a type of health insurance plan that limits coverage to care from doctors who work for or contract with the HMO. They generally provide integrated care and focus on prevention and wellness. So phlebotomists can be hired to draw samples from patients in these plans. Phlebotomists are also needed at reference laboratories. So these laboratories are private commercial facilities that do high volume, routine, and specialty laboratory testing. Urgent cares and nursing homes also require phlebotomy procedures. Home healthcare companies are those that travel to the patient's home to give them their care, and these patients also may need phlebotomy services. Like HMOs, some insurance companies may need the use of a phlebotomist. And lastly, blood donation centers. So this is where volunteer donors come to have their blood collected in large quantities to donate to those that need blood. A phlebotomist is, of course, required to perform this donation procedure. Phlebotomists who work in a hospital need to know the different patient care areas, all in which they may be required to go to in order to draw samples. The Cardiac Care Unit, or CCU, is an area where patients are treated for acute cardiac disorders, which are disorders of the heart. The Dialysis Unit helps treat patients with severe renal disorders. So these are disorders of the kidney. The Emergency Department, or ED, are those that patients that come in for immediate emergent care. The Intensive Care Unit, or ICU, is for those patients that are critically ill. Labor and Delivery, or L&D, is for childbirth. And Medical Surgical Units, or Med-Surg units, are used for patients that require just general care. The Neonatal Intensive Care Nursery, or the NICU, is for newborn patients that have complications. The nursery is just generally for infants. The Oncology Center is for patients who are receiving cancer treatment like chemotherapy and radiation. The Operating Room, or OR, is for patient surgeries. Pediatrics Unit is for children. Patients that are in the Psychiatric Unit are mentally ill and receiving care. The Recovery Room is for patients who are recovering from surgery from the operating room. And the Short Stay Unit is for patients that are getting outpatient surgery. So these are surgeries that do not require an overnight or extended stay at the hospital. They basically have their surgery, stay for a little bit in this short stay unit, and then they are released to go home that same day. In a healthcare delivery system, each department will have a specific purpose. Nurses have direct patient care. Support services maintain the facilities and equipment. Fiscal services performing budget control and billing. And professional services assist in diagnosis and treatment of disease. Nursing services can work in many areas of the hospital, including the cardiac care unit, the emergency department, the intensive care unit, and the nursery, and also in the operating room. So all those units that I discussed earlier, nursing services can work there. In nursing services, there are a couple of different members of the team. There can be registered nurses, or RNs, associate degree in nursing, or ADNs, or those that have bachelor's of science degrees in nursing, which are called BSNs. Then there are licensed practical nurses, or LPNs, and certified nursing assistants, which are also called CNAs. A unit clerk is someone who performs clerical and administrative duties for the nurses, such as answering telephones and assisting patients. Within a healthcare system, there are supporting services that help make the system run. These include things like food service, grounds care, housekeeping, and human resource departments. Support services also include laundry, maintenance, purchasing, and security. All of these areas do not involve direct healthcare to the patient. However, they are responsible indirectly for all patients that receive treatment within any healthcare system, because they help make that healthcare system run efficiently and effectively. Fiscal services are responsible for the financial activities of the healthcare system. These include things like accounting, admitting of patients, business offices, credit and collection, processing of data, and patient medical records. Healthcare systems also have professional services. So these include things like radiology that provide things like x-rays, CT scans, and MRI scans. There's also radiation therapy that is provided for patients that are receiving treatment for cancer. Nuclear medicine uses radioactive material inside the body to see how organs and tissues are functioning for the diagnosis of disease. Occupational therapy provides a form of therapy for those recuperating from either a physical or mental illness that encourages rehabilitation through the performance of activities required in daily life. So things like doing laundry or taking showers, things like that. The pharmacy is providing or responsible for providing medications for patients within a healthcare system. Physical therapy is another professional services provided by healthcare systems. Physical therapy addresses illnesses or injuries that limit a patient's ability to move and perform functional activities in their daily life. Respiratory therapy helps treat patients with breathing disorders. Professional services also include cardiovascular testing. So these are tests on the heart, which include ECGs, stress tests, and imaging. And then, of course, clinical laboratory services are considered professional services as well. These include phlebotomy services and diagnostic testing on the samples drawn from the phlebotomist. So this concludes this lecture. If you like this lecture, please give it a like and please subscribe to my channel. And as always, if you have any questions, please feel free to leave them below in the comments.